Good afternoon, everybody. My name is Dr. Priya Raghavan. I'm a consultant psychiatrist working at Cadabams Hospital in Bangalore. I welcome you all to this afternoon's live webinar on dementia. I would like to speak to you today on the occasion of World Alzheimer's Day 2021. The theme for this year is Know Dementia, as in get to know, K-N-O-W, dementia. The reason why this topic has come about for this year is simply to promote awareness of dementia, get to know what constitutes dementia, what doesn't, just so you're able to access treatment and get adequate support for your patients and families put together. So we can all join in the fight against dementia. So there's quite a few topics that we need to cover today, and I will be going in the following order. First, I'm going to be speaking to you about why we need to speak about dementia, what are the different conditions that mimic dementia, dementia itself, its diagnosis, treatment, and finally a little bit about healthy aging and probably aging gracefully. And I will then conclude with my summary of points for you all. So, I will be speaking to you in my capacity as a specialist in old age psychiatry, having worked as a consultant in the United Kingdom and also currently working as a consultant here in Bangalore, which also means I have the experience of working across two nations, but also across two different health systems. And why do we need to even speak about elderly people today? So if we have to try and understand this, we need to know that we are living now in a changing world where people are living for much longer. There's increased longevity for the last few decades given to advancements in scientific, medical, and technological fields. This essentially means that a lot of other conditions which we did not know about in the past are now coming to the fore. One of the most important among them would be various dementias. Alongside increased longevity, we are also living in a world looking at changing health needs, which means changing physical needs. So the longer you live, then that basically means people are getting older, living for longer, having a lot of physical health conditions like restricted mobility. It could be due to arthritis, or it could be various pains, it could be frailty, wherein they are getting just weaker, falling, difficulty moving, various infections, etc. It also then leads to various changing mental health needs, because undoubtedly if there's a physical health need that does impact on the mental health of individuals, this means elderly people are bound to have various mental health conditions like depression, anxiety, stress, of course dementias. We are also living in a world where our societal structures are changing. As an example, I think our country was a country which lived within the joint family system. This is now increasingly disintegrating as we are all living in nuclear families. This is also because of the shift a shift in migration, wherein youngsters from villages and towns wish to come to cities, and youngsters in the cities wish to move abroad. This essentially means a lot of our elderly population are actually left within their own homes and villages and in cities, not necessarily to fend for themselves, but certainly on a day-to-day basis, this does pose some practical challenges. So within this context of change, we are witnessing people with a lot of memory problems. And when it comes to memory issues, we have different sets of people. There'll be, I have seen in clinical practice a set of people who are particularly not worried about their memory at all, despite the fact that there are obvious glaring memory issues. Patients and families are not worried as they simply attribute it to normal aging. We also have another set of people who get very worried at the prospect of slight memory problems, and they start to worry that they have dementia, and they get all tests done. So I think it's important to set facts straight today, and we need to know what is normal aging, what is an abnormal process. So before we actually start talking about these conditions, I want to draw your attention to this term called cognition. Cognition is essentially a term that encompasses various characteristics like memory, language, thinking, reasoning, judgment, making decisions, implementing decisions, solving problems, etc., etc. All these things, what we call the higher brain function, put together constitute what's called cognition. And we are going to be using the term cognitive decline quite a fair bit today, and this is why I wanted you to know what cognition actually means. So, when you come across elderly people, for example, it could be your dad, uncle, aunt, or your next door neighbor at home having the odd slip in their memory, it doesn't necessarily mean they have dementia, because growing old, as we all grow old, we are bound to forget a little bit. So, as we grow older, our body systems do start to slow down. Brain is no exception to it. So the aging brain will show some normal changes, like a little bit of stretching, a little bit of thinning, and as a result of these structural changes to the brain, there may be occasional lapses in memory. You may find that your dad or your granddad or your aunt is not able to multitask as well as they used to before, but they are still very much with it. They are still very sharp, and they can still do all the tasks that they were able to do before, except that they need that extra bit of time, because the brain has slowed down a little bit. It needs time to process things, but it's all very much there. So cognitively, they are very much intact, just that they have slowed down a little bit. This is what we call normal aging. This does not mean you have dementia. It's very much a natural process, and it's nothing to worry about. And how do we maintain this, or how do we ensure that we are reducing the risks for developing dementia, is something I'm going to be speaking about at the very end. So given that this is normal aging, then I would like to draw your attention to the other end of the spectrum, which is dementia. And when I say other end of the spectrum here, I mean it's an illness. It's a disease of the brain. So what exactly does dementia mean? The term dementia essentially refers to a disease of the brain. It is chronic in nature, in the sense it is long-standing, and it also is a degenerative condition, which means it gets worse with time. So essentially, dementia is a chronic neurodegenerative disorder that occurs because of underlying diseased processes in the brain, whereas normal aging is perfectly a part of aging and is not a disease. And it's very important to differentiate these two conditions, because treatment is necessary for dementia, whereas treatment is nowhere required for normal aging. So when we are talking about the diseased brain, then we have many questions coming out. For example, people ask us, are dementia and Alzheimer's the same? And I would say dementia simply refers to a cluster of symptoms. It is what we call a syndrome. So the diseased brain comes out with a cluster of symptoms called dementia. And under the banner of dementia, we have several subtypes. The most common subtype is Alzheimer's. I'll come back to that in a minute. Before that, I want to talk about some symptoms of dementia, because this is what many people will need to actually watch out for. The most common symptom of dementia, as you all know, is lapses in the memory. And when we say memory, it usually starts off with short-term memory. And eventually with time invades the long-term memory. And I want to draw your attention to this because many families, when I ask them casually in the clinic, how is your mom's or dad's memory, they say, oh, it's absolutely fine. They remember everything from way back. But of course, they don't remember anything, that's happened recently. And I'd like to say that that is something that needs explored because it could be a dementia or it could be part of normal aging, but something that requires workup. So one of the hallmarks of dementia is short-term. It starts off with lapses in the short-term memory, and as the dementia progresses, invades the long-term memory. So you may find that your near and dear one forgets things frequently. It could be forgetting days, dates, appointments, where they put the keys, did they take the tablets, did they not take the tablets. Taking the tablets, forgetting it, and then taking them again is actually a particular risk that we see and we need to reduce. So memory lapses will manifest in this particular fashion. As the dementia deteriorates, there are many people who cannot maybe recognize their own son or daughter because in their mind, they are back in time, they have traveled back in time, they are in a very different time zone because as I said, the short-term memory is the one that gets erased first, and as the dementia progresses, it invades other aspects of the memory. So if your 85-year-old mom cannot recognize their 50-year-old daughter is standing in front of them, it is mainly because in their mind, in the 85-year-old mom's mind, the daughter is still about 15 years old or 20 years old, and it is that daughter that they can recognize because they are in a very different time zone. So one of the hallmarks, as I said, is memory problems. There are other symptoms of dementia like language difficulties. You may find that a person with dementia is not able to take part in a conversation because they are not following the thread of the conversation. They may start to say something and they may stop abruptly, probably because they have lost track or because they are not able to get the right words out. Or simply because they don't understand what is being spoken anymore. So language difficulties could be in two different ways. As in spoken language, they may struggle to find the words or they may struggle to understand what is being spoken. Some of the other symptoms of dementia include difficulties in recognition. It could be recognition of objects, things, people, places, faces, anything. And I just gave you an example of mom not being able to recognize their own daughter. It is a combination of a memory lapse and also difficulty in recognition. I remember one of my patients who did not know where to put the bread. Instead of putting it in the bread basket, she ended up putting it in the tea kettle because she could not recognize that that was a tea kettle and not a bread basket. We also find patients who actually pee in the kitchen sink and not in the toilet because they are not able to recognize anymore that that's a kitchen sink. And they are not allowed to do so. Some of the other symptoms of dementia could be difficulty with spatial orientation. So you may find that your granddad who has been living in the house for the last 40 years does not know where the toilet is anymore. You may find that the same grandfather goes down the street and cannot recognize the familiar routes, and he may get lost. I mean, how many times have we seen, families coming in saying, "Oh, my dad or my granddad so and so was lost," and some stranger thankfully got them back home in an auto. That's because they have lost their sense of spatial direction. So these are all some symptoms of dementia. But we call it as a dementia only when the cognitive decline, which I spoke to you about, is also accompanied by functional decline. What I mean by that is when there are lapses in memory, language, thinking, reasoning, judgment, recognition, and etc. When these actually impact their day-to-day functioning, like they can't go to the shops anymore, or they're not able to buy vegetables anymore, they're forgetting lists, or they're losing track of money, they don't know how much money they have anymore in the bank, or they don't know who came and went, and what kind of will they have made, etc., if they do not have knowledge of these things anymore. So there is a cognitive decline alongside a functional decline for at least a period of minimum 6 months. Then we call it as a dementia. So these are all some of the clinical features that I would like you to perhaps make note of before you start panicking that your near and dear one has a dementia. And of course, if you're in doubt, you're always welcome to come and see us. So that leads us on to the next question. So what causes dementia? To be perfectly honest, we don't exactly know that one thing that causes dementia. There is an explosive amount of research that is happening in this particular area, and now we've come up with a set of risk factors all pitted up one against the other that will increase the chances of anyone developing the condition. So the first and foremost, the single biggest risk factor for dementia is age. And this is what we call as a non-modifiable risk factor, because we cannot help the fact that people grow older. So the older you get, the higher your chances of getting a dementing illness. But that alone, as I said, is not enough for someone to get a dementia. There are some other factors that we can work on to reduce your chances of dementia. And what are they? Some of the other factors are what we call vascular risk factors. Vascular essentially refers to anything, any factor that interferes with the blood flow in your body. So it could be things like high blood pressure, diabetes, obesity, heart attacks, previous strokes, smoking, alcohol, kidney damage as a result of diabetes or hypertension. All these factors put together are classed under vascular risk factors because these things will affect the blood flow to any organ in the body by affecting the tubes that carry blood. The tubes, what we call arteries, they get affected by all these risk factors so that the tubes become very hard, inflexible. It increases blood pressure, they get clots inside, they get cholesterol deposits inside, etc., etc. And these culminate in stroke. If it happens in the brain, it culminates in heart attack. If it happens in the heart, and if it happens in the leg, it's what we call peripheral vascular disease, etc., etc. So all these risk factors that cause heart disease also cause dementia. They also cause brain disease. So the simple thing is, if we are able to address all of these risk factors, then your risk of developing dementia actually comes down. Yes, there are some other non-modifiable risk factors like genetics, and we can't do much about that. Again, however, dementias occurring within the family amounts to almost 1% or even less. So I don't think we should worry about that too much. When dementia does not run in families, it's a very, very small percentage. Of course, what it also means, there are some genetic factors that increase your risk, but you don't invariably get it. So what I mean by this is, somebody has cancer in the family. If dad has cancer in the family, it does not necessarily mean the son will invariably get it. It does mean, however, that his chance of developing that particular type of cancer is a bit higher compared to the rest of the normal population. Same with dementia. If mom or dad or a sibling in the family has dementia, then you as a son, daughter, or the other sibling have a slightly higher risk, but not invariably so. So these are all some risk factors of dementia that we need to be aware of. And what happens as a result, of these risk factors? We spoke about the clinical symptoms, but what is it that actually happens in the brain that causes these symptoms? Lots of things, and as I said, there's a lot of investigation, there's a lot of research that goes on into these processes. As an example, if I have to say what happens in Alzheimer's disease is the disease process for Alzheimer's actually starts decades earlier than the clinical symptoms. So it is fair to say that Alzheimer's disease changes in the brain start as early as 40 plus years, when you're at the age of 40 plus, but the symptoms develop decades later. And do not get disheartened by that, because I said there are lots of other things that can be done to reduce the risk of dementia, and not everybody who has Alzheimer's disease changes in the brain go on to develop clinical symptoms. So what happens in Alzheimer's disease is that, the brain is made up of, I'm going to digress a little bit, the brain is made up of billions of neurons. Neurons are what we call, nerves, basically nerves. So each nerve, you can imagine a nerve as having a head and a tail. So the two put together are called neurons. See, the tail portion of the nerves, again, there's billions of them, and they all kind of talk to the other nerves with these tails being connected. So one tail gets connected to another tail at a junction. And what happens at these junction is that there's a release of chemical from this nerve to the other nerve, right? So what happens in dementia is there are changes that occur at this microscopic level, at the cellular level, at every single level. So you have structural changes in the brain, as in when you imagine, billions of nerves in your brain, the nerves are kind of kept connected to each other by by the intervening tissue. Now, in that tissue, if there are what we call abnormal beta amyloid deposits or plaques. They are protein deposits that are found in between these nerves, that actually damage the nerves, that damage that chemical process, what I told you. The chemical, connection between the nerves is damaged by way of these plaques. And inside the nerve heads, what I spoke about itself, there is accumulation of abnormal proteins called tau, T-A-U, tau proteins and plaques. These are some of the basic changes that actually occurs in Alzheimer's disease brains, and these changes are so profound that the chemical talking, that the chemical messengers, that the way they kind of talk to each other is all affected. So this is just an example of what happens in Alzheimer's disease. If you look at other diseases like vascular dementia, the blood flow, as I said, to the brain is not as good as it should be, and that can cause memory problems. So to my earlier question, do dementia and Alzheimer's mean the same? No, dementia is a group of symptoms. It's a syndrome. And under dementia, you have several subtypes. Alzheimer's dementia is the most common type of dementia. About 70% of people have Alzheimer's disease. The next common would be your vascular dementia, and as I've already said, it's a blood flow to the brain that is affected that causes memory problems. This is what we call vascular dementia. Some other types of dementia would be Lewy body dementia, Parkinson's disease dementia. Lewy body and Parkinson's disease dementia occur more or less in the same continuum of conditions. So some people may develop Parkinson's disease first and then go on to develop a dementia, and some people may develop Lewy body dementia first and then go on to develop Parkinson's symptoms. Leave this to the experts, but what I'm just trying to tell you is there are different types of dementia, and the reason we have different types of dementia is because it has some implications for treatment. Some of the other types of dementias you may wish to know about are what we call frontal temporal dementias, occurs in much younger people, and they are the more difficult, more challenging sort of dementias, because the issues there would also be much more complex. So with these different kinds of dementias, what do you, just in case you're getting overwhelmed and you're thinking, what do we do next? So this is where it's very important to investigate the condition, do a proper dementia workup, and then arrive at a diagnosis. And when I say arrive at a diagnosis, we spoke a bit about normal aging. I spoke about dementia. It's not just these two conditions that walk into your clinic. There are many, many other conditions that mimic these, mimic dementias. For example, mild cognitive impairment. So as the name suggests, there is a cognitive decline here. There is cognitive impairment, which is mild, and it's not severe enough to be classed as a dementia, and it is certainly not mild enough to be classed as normal aging. So MCI is a category which we come across quite frequently. That is a gray zone between normal aging and dementia. Why is it important? Because some types of MCI are actually because of an underlying Alzheimer's disease process, and these MCIs can go on to develop dementia. And then there are other MCIs which do not go on to develop dementia, they just stay there. The reason they stay there is because of some of the underlying conditions that cause mild cognitive impairment. When I say MCI, the way it presents is, yes, your grandfather may be repeating things, forgetting things repeatedly. He may not know where he put his keys, and he may not exactly remember if he took tablets or not, but he will eventually get there. He may land up asking you questions repeatedly, but despite all of these lapses in memory, lapses in language, he's still able to function reasonably normally. So if you have cognitive decline but no functional decline, then we call it as mild cognitive impairment. If there is cognitive decline accompanied by functional decline, we call it dementia. If there's no cognitive decline, just a little bit of slowing and absolutely no functional decline, it is just normal aging. So it's quite important to differentiate these because, as I said already, dementia can be treated. We will need to keep an eye for MCI to see if it progresses to dementia. Some of the other causes of MCI would be things like some vitamin deficiencies, particularly in vegetarians, where vitamin B12, which is commonly derived from meat, if it is deficient, or an undetected thyroid disorder, overactive thyroid, underactive thyroid that is not treated, can present a bit like dementia or mild cognitive impairment. So if you do the workup, the bloods and all the investigations, detect these issues, address them, you may find that the mild cognitive impairment returns to normal, depending on the underlying cause, of course, and some mild cognitive impairment will stay where it is. For example, if there's vascular damage to the brain, you're a bit forgetful, but it's still not translated into functional decline, then you would call it as MCI because of vascular causes. And then, of course, MCI progresses to Alzheimer's dementia if it's because of an Alzheimer's process. The conversion rate from MCI to dementia is about 15% per year, 10 to 15% per year. That means 10 to 15% of cases with MCI will go on to develop dementia that year. So it's important to actually keep an eye on all these different conditions. And how do we do it? So I will give you an example of what we do at Cadabam, so you have an idea of what to expect. As I said, it's very important to tease these conditions out to see, is it dementia? Is it MCI? Is it normal aging? Is it something else like a depressive illness? Because depressive illness also is a risk factor for dementia. And another condition called delirium, which essentially again refers to a set of symptoms wherein there is a sudden onset of confusion, sudden onset of memory problems, sudden disorientation, don't know where they are, what they are doing, but all in the context of physical illness is called a delirium. So delirium, dementia, depression, these all kind of go together in the elderly population. So when anyone presents with confusion, memory problems, low mood, etc., it's very important to tease out the different causes and see what is it that they have. Is it delirium? Is it dementia? Is it depression? Is it normal aging? Is it MCI? What is it? Because the treatment is very different. If it's a delirium, it would be a bit silly to treat them for depression. So for example, let's say if the sudden onset confusion is because of low sodium, it's because of very high sugars, and you end up treating them for depression, then they are not going to get better. If any, they're going to get much worse. Similarly, if someone has a depressive illness and you treat them for dementia, the depression is not going to get better, it's going to get worse. So it's very important to tease these things out and see what condition they actually have before we treat them. So how do we actually go about addressing these symptoms? Let's say you have a concern, you're not sure if it's a delirium, dementia, is it just normal aging, or could they be depressed? What do we do about it? So it's very important, as I said, to first diagnose dementia. And diagnosing dementia essentially means ruling out the other conditions like depression, delirium, etc. And then diagnosing dementia and coming up with a treatment for the same. How do we do it? So the way we do it in Cadabams and in fact worldwide, what happens is that we'd first like to meet the patient, gather all the information as much as possible from the patient, and very importantly from the family, because once somebody has a diagnosis of dementia, it's very important to work with the families because they are the ones who are providing care, and they will also need a lot of support because there is a significant amount of carer burden involved as well. So what we do at Cadabams in our memory clinic is that we see the patient first at the first assessment, we gather information from them, and also speak to the families, see what the concerns of the families are, and we'd like to know a timeline of events. Having spoken to the patient and the families, we try and understand, try and piece together what is it that has happened, when did the problem start, what is the nature of decline, etc. We'd like to know more about your physical health, medication, all the risks we spoke about. It could be forgetting to turn off the cooker, it could be going out of the house, not coming back because you don't know the way, etc. So we gather all information as much as possible in the first appointment, and then we would need to do a basic set of investigations in most people, as I said, to rule out the other conditions. So if someone's a diabetic, if someone has had recent surgery, etc., there may be a lot of things that's going on in the bloods that we need to know about. There could be simple infections. So we would ask for a blood screen. We would need to do other basic investigations like an ECG and also a brain scan. The brain scan is done mainly to see what's happening in the brain. Is there any vascular damage? What is the extent of it? What's the size of the brain, particularly the areas that's responsible for the memory, etc. And so we have clarity around what is happening. So we put then in the second appointment, we put all of these things together. We gather all, your blood reports, your brain scan reports, information from the patient, from the families, and also do memory tests, what we call cognitive testing. Depending on how much the person is able to do, we may have to do a series of tests to identify exactly what is the level of cognitive problems that this person is facing, what's the severity of it. So we have it on paper, use that as a baseline. And based on this, we can then arrive at a diagnosis. If it is a dementia, we will tell you what it is, and we will also speak to you about what the diagnosis entails and how is this condition going to progress. Because now coming to treatments, there is no real cure for dementia, as you know. There's a lot of research happening in this area, but we haven't found a cure as yet. So medications are available, and what do these treatments do? They essentially slow down the progress to some extent, and so they provide a stability of life and a better quality of life. And tablets and medication also help in managing some of the other symptoms of dementia, as I said, like if there's a language difficulty or if there's too much agitation, etc. These tablets, the anti-dementia tablets, might help in addressing some of these issues. So alongside anti-dementia tablets, we also many times find the need to prescribe other psychiatric medication as and when the condition progresses, because most people with dementia go on to have what's called BPSD, behavioral psychological symptoms of dementia, wherein they are shouting, screaming, in distress. They may have hallucinations, some low moods, etc. So we may find the need to use psychiatric medication to address some of those symptoms as well. So when you look at treatments for dementia, yes, we have pharmacological, that is medication treatment. We have a lot of talking treatments, useful talking treatments. For example, reorientation therapy, wherein you're reorienting them, bringing back to where they are, telling them the day, date, month, year. These are simple things you could do at home. Validation therapy is an interesting thing, because sometimes if you're telling the person in front of you, telling your dad, Daddy, today is not December 20th, it is not 2021, and your dad's insisting, no, this is 1955, and getting very angry, wound up. There's no point in going and arguing with him. You may eventually learn with time and with our help and with our support that it is sometimes best to leave things the way they are and not argue with the person and explain to them when they are calmer. In the sense, you're providing validation for your dad's thoughts. There's other things like cognitive stimulation therapy. This is a particular type of talking therapy that can actually even be done by families and carers and can be very useful in stimulating cognition for the person with dementia. And it also allows you a chance to actually know much more about your mom and dad than you actually knew. So it's going back a bit in time and doing various things that they enjoyed or they perhaps remember about. And so it stimulates their memory. Then there are talking treatments that can be done, medication that can be given, and of course, not to mention the practical aspects of caring for someone with dementia. This is something our social workers in our organizations will help you with. It may be providing tips about offering practical support. For example, if you find that your dad is struggling to take a shower because it's way too slippery, then we may ask you to install handrails, bath rails. You may need banisters in your house just so they don't fall off while going up the stairs. It could be other simple practical things like maybe even installing a clock in every room, nice and bright, so they know exactly what the time is, and don't get up at 2 in the morning and wander into the kitchen thinking it's 7 o'clock in the morning for tea and biscuits. So there are lots of these practical things that we can do as well, and we will help you with all of these. We also give you plenty of information following a diagnosis of dementia, about the diagnosis, what to expect as time would go on, just so you are prepared. And wherever possible, we will offer practical help as well. We'll also tell you about resources and help that is available in the area where you're living, so you're much more prepared to deal with the condition. And most importantly, we professionals are able to comment on capacity, because mental capacity is something that deteriorates with time. And this is why, for people with dementia, and this is why it's vitally important that we diagnose the condition, catch it early, so we can make arrangements. For example, if there are many families who do come in very late, they realize much later in the course of the illness that this doesn't sound like normal aging, there's something else happening here. We tell them it's dementia and everything, but it may be too late for them to put their affairs in order. And how many families have we seen, brothers, sisters, at loggerheads because of property issues, because of care issues. They are not, because they haven't accepted the diagnosis themselves, and these things take time. So it's much better if early diagnosis is given so that all these arrangements can be put in place. So what I would like to tell you is there's plenty on offer. There are things that we can do, although there is no cure, and we will be helping you every step of the way here at Cadabams. So finally, before I'd like to call it a day, I'd like to give you a few tips about how to age healthily, because not everybody is going to develop dementia. Most of us are going to go through normal aging. So I'd like to tell a little bit about how we actually do that. So the most important thing I spoke to you about was the vascular risk factors. So that is very closely linked to lifestyle changes. As I already said, all factors that affect the heart also affect the brain. They reduce the chance of dementia. So addressing your lifestyle reduces your risk of dementia by 1/3, and that's a significant number. So it's very important to actually exercise regularly. So it's never too late to start. So if you're not exercising, try and do as much as you can. You may be 40, you may be 50, you may be 60, you may be 70 or even 80. Do whatever you can, even if it is just sitting in your place and wriggling your legs if you're 80 and you're not able to do things. So the general recommendation, however, is that you get about 150 minutes of moderate intensity exercise per week. That's about 20 to 22 minutes per day. It can be done, and this could be like cycling, brisk walking, dancing, etc. The other thing to do, yoga will also help. The other thing to do would be, linked to your exercise, is also diet. Having a good diet, a good balanced diet. And I'm not suggesting that you have a balanced diet every single meal of your day, because it's really not possible, but try and ensure that you eat at least 5 portions of fruits and vegetables. So it could be 4 fruits and 1 vegetable, or it could be 3 fruits and 2 vegetables, etc. 5 portions of vegetables on most days. You would need to cut down on starch and carbohydrates. Not more than 1/3 of the energy should come from starchy foods. And when you're eating starchy foods, try and eat whole foods like whole wheat, etc. Cut down fat, needless to say, and there's a lot of controversy about saturated fat, its health benefits and its the bad effects of saturated fats. I think it's reasonable to say foods containing saturated fats like coconut oil, palm oil are reasonably good as long as they are had in moderation. Certainly the saturated fats, trans fats coming from deep fried food, processed foods like your burgers, pizzas, hot dogs, etc. You would need to cut down on them. Try to eat it all in moderation as much as possible. The other thing would be proteins. Yes, increase your intake of proteins on a daily basis wherever possible. Also get it from all the dals, pulses, your beans, etc. Cut down on red meat because it also contains a lot of fatty food. Go for lean meat like chicken, fish. Again, it's supposed to be very good, the omega fatty acids in there. These all cut down the risk of your dementia. Good diet, exercise. Also your weight. You need to watch your weight. So your weight, whether you're at your ideal body weight, will depend on your age, your height, your genetics, and also your ethnicity. So there's plenty of websites on Google. Just Google your your BMI, and you will need to do some exercise to get to that BMI. The other thing to actually watch out for would be alcohol. So if you're drinking too much, please cut down. If you that's the general advice for most people, but if you already have liver damage, then there's absolutely no alcohol for you. And when I say cut down, what you're generally allowed is about 14 units of alcohol per week for both men and women. Previously, it was 21 units for men, and the guidelines have now been revised because 21 is way too harmful. So 14 units for men and women. How to calculate units, etc., is a different story altogether. We'll cover it another day. But essentially, even about half a bottle of whiskey, half a bottle of rum, that's about 360 mils, would amount to somewhere around 14 units. So you'd need to drink a bit less than that. And if you're drinking 14 units in a week, ensure that you're spreading it out over 3 or 4 days and not drinking all the 14 units in one go, because again, that's very toxic to the brain and puts you at risk for various dementias, especially alcohol-related dementia. So we've spoken a bit about alcohol, your weight, your diet. We also need to speak about smoking. Please stop smoking. We know the ill effects of smoking, and I won't go into it much today. Other than this, there are other things that we need to do in order to lead a healthy life and age healthily. What are they? Some of the things I would like to speak to you out with the lifestyle changes are coping with change. Very important to cope with change, learn to cope with change, because there are many things that can actually go wrong as we grow older. This could be loss. It could be loss of a partner, loss of son, daughter. It could be loss of a job. It could be retirement. It could be children getting married, moving away from home. It could be any of these things, or being diagnosed with a physical illness. But it's very important that we learn how to cope with this, not get bogged down by the negatives in our life, but it's very important to acknowledge and understand and focus, learn to focus on what's actually going good. And that will give us an impetus to try and see how much of it we can fix when things are actually going wrong. And if you're not able to fix it, then how do we actually accept it? So for example, if we've lost a loved one, we're not going to be able to fix it. But with time, we will eventually learn how to accept their death. And there will be, of course, a grieving period. But that is, again, considered totally normal. So it's very important to cope with change, accept what's going on, and if there's something that we are upset about, I think it's important we learn to express those feelings. So if you're not able to talk it out with your near and dear one, write it down so that it becomes much more clear, makes sense, just so we are able to address those issues. Very important to learn from mistakes. Who doesn't do mistakes? Apart from coping with change, it's also important to find meaning and joy in whatever we do. So instead of getting upset, thinking that son is married, he's not paying attention to me anymore, I think it's very important for us to actually go and learn something new, find a little bit of enthusiasm. It could be learning a new language, it could be learning computers, or in fact trying to find out how you can actually integrate with your son's new family. So you may also wish to do some voluntary work at your local place where you live. It could be at the street. You could do an organization to keep your place neat and tidy in your road, or it could be maybe volunteering at the local temple. If you want to spend time with nature, by all means go and do it. So it's important to try and find new meaning in your life so you're also able to cope with change. The third important thing is to stay socially connected. And I cannot stress the importance of this, because isolation, lack of social connection, these are all connected. These are all linked to depressive illnesses, and they in turn are linked to dementia. So stay connected. If it's not possible to go out now because of the pandemic, which is totally understandable, it poses its own threats, then there's plenty of other ways to socialize. It could be online, it could be through Skype, video calls. You will know all of these things better than me. It's also important to maybe make connections with the younger generation. It could be from your family, it could be with your neighbors, because they can also prove to be very useful, helpful. A lot of things to learn from the younger generation as well, like technological advancements, etc. And they may learn a lot of things in turn from you. So as I said, important to stay connected, meet your friends, family. If you can't go, invite them over. And I think that those things will have a positive effect on your mood. And the other important thing is any physical health issues, please get them addressed. The number of ways you can do it. So in those days, we used to have this concept of family physicians or our GPs. It may not be such a bad idea going back to that now, because right now we are all bogged down on going to different specialists. So you go to the neurologist, which is very important. If you have a neurological problem, we go to cardiologist if there's a cardiac issue. Again, very important. And we cannot neglect these aspects of life, but also somewhere in our thirst to see different specialists, we have lost the continuity of care, in my view, and so your neurologist is not going to know what's happening from the cardiac side, and cardiologist doesn't know what's happening with the neurological side, and we need somebody who's going to tie all these things together, and in my view, it is a GP. So I think we perhaps have to think about making that connection with the GP, so the GP knows what exactly is happening in each specialty with this patient, so we can take a decisive call on things. It's much easier to do it that way. Of course, by all means, see specialists if needed. Take your medication regularly. If you're struggling with medication, ask your son, daughter, family, or anyone who's going to be able to help out to sort out medication in those dosette boxes, which we get. So it's easier to take medication for you. Seek timely help. So with all of these things, I think at the individual level, I have no doubt in saying that you will be aging healthily, and you'll also be aging gracefully. So as a summary, I would like to finish by saying, yes, it's very important to know about all the different conditions alongside dementia. Please come and see us. We will help you out, in teasing out the different conditions, providing the right care. Do not panic. And irrespective of the diagnosis, it's very important to actually work on your lifestyle and all of the other things that I just spoke about, so we can actually age gracefully and also join us in the fight against dementia. Thank you.